Right, so you look at what the government's doing to the NHS, and you have to laugh, because if they were trying any harder to prove the Forde Report right, they'd invoice themselves for the labour. They've decided the health service isn't creaking because of understaffing or collapsing infrastructure. Oh no. The real emergency is that too many nurses have opinions the government doesn't approve of. So now the Department for Health and Social Care is rolling out a racism policy that somehow manages to mention antisemitism 28 times and Palestinians not once, all while turning mandatory training into a political obedience test. Doctors in Unite have called it exactly what it is, a top-down attempt to hardwire a hierarchy of racism into the NHS to silence Palestine solidarity. And once you see it, you realise the repression is not accidental. Labour have literally made it policy. Right, so Labour are taking a system that's already buckling under pressure, a workforce that's been brutalised for years, and instead of fixing anything, they're dealing with pay, safety, retention, or the collapsing estate, putting patients first like the staff in the NHS do themselves. They've decided the real priority is to criminalise a colour scheme and turn a workplace code of conduct into a foreign policy enforcement mechanism. And it only makes sense once you accept the central fact that doctors in Unite are laying out in painful detail that this isn't about anti-Semitism in the NHS, it's about shutting down Palestine solidarity among the one group of workers whose voices the government cannot afford to let the public hear. Because health workers describing what's happening to hospitals in Gaza is one of the few things that cuts through the noise, you see, and the government knows it. So the Department of Health and Social Care puts out a statement on the 16th of October talking about urgent action to tackle anti-Semitism and other forms of racism in the NHS. And you can see the hierarchy right there at the get-go, can't you? Anti-Semitism gets 28 mentions. Islamophobia gets 2. Palestinians aren't mentioned at all. The other forms of racism catch-all is thrown in like a legal obligation, as if racism is an administrative category rather than something people actually live through. And you don't need a political science degree to work out what's going on. The government hasn't learned from the Forde Report, has it? It's proving they haven't. The same hierarchy of racism that report exposed, that report detailed, inside the Labour Party, is now being reproduced across the NHS. Not through reflection, but through denial. Because the leadership still pretends that hierarchy never existed. It's almost impressive, in a cynical way, how quickly they've moved from "we deny the hierarchy exists" to "we are now operationalizing that hierarchy across the entire NHS workforce." And the telling part is that the government didn't even bother to consult anyone who might be impacted by this. Not staff, not unions, not Palestinians, not Muslims, not Arabs, not the communities actually facing the bulk of racist abuse in Britain over the last 2 years. Instead, they asked 4 pro-Zionist groups to effectively sign off on turning the NHS into an ideological test site. And when you see the fingerprints of Lord John Mann pressed right across it, the same Lord Mann who has spent years saying anti-Zionism is anti-Semitic, who calls anti-Semitism the worst of racisms, and who insists the IHRA definition is the only definition that matters, well, the agenda becomes unmistakable. And yes, it matters that Wes Streeting and Keir Starmer have taken substantial pro-Israel donations over the years as well, because it speaks to political incentives, doesn't it? Not some grand conspiracy. You don't need to imagine a secret meeting. The incentives are baked in. The party leadership has tied itself publicly and financially to a political faction that insists criticism of Israel must be policed. So, of course, the policy infrastructure reflects that. Of course, the government line bends to accommodate those relationships. That isn't speculation, that's basic political mechanics. When a government decides to ignore professional bodies, unions, staff networks, human rights groups, and the courts, and instead moves in lockstep with donors and lobbyists, you're not supposed to treat that as normal. You're supposed to ask, why is that happening, and who is benefiting from it? Doctors in Unite have called it exactly as they see it. Look at who the policy elevates, who it ignores, who it punishes, and the shape of this thing becomes impossible to miss. The government keeps insisting this is about tackling racism, but every operational detail points somewhere else entirely, towards restricting what NHS staff can say or show or even feel about Palestine. But the documents lay it out. They're about to impose the IHRA definition, the same definition that was partially defanged in the High Court because several examples violate protected political expression. They're planning enhanced anti-Semitism training that will be tied to statutory and mandatory competencies, meaning you can fail your professional obligations unless you affirm what is essentially a political doctrine. And then they're issuing workwear guidance to ban Palestinian colours, symbols, jewellery, lanyards, screensavers, watermelon patterns. Anything that could be possibly construed as solidarity. Meanwhile, the DHSC, of course, threw the Israeli flag from its building, didn't they? The neutrality line is an absolute joke, and everyone can see it. And this is where the deeper dishonesty comes in. If the NHS had an anti-Semitism crisis, if the data showed a runaway surge in incidents inside the service that required some sort of emergency intervention here, the government would be shouting the numbers from the rooftops, wouldn't they? They'd be on every broadcast outlet waving spreadsheets telling you this is why they need to crack down. But what we actually see is something completely different. The government making hysterical claims about anti-Semitism flourishing and being out of control, without any evidence to support that, while ignoring every documented incident of Islamophobic or anti-Arab racism in the same period. So you realise the numbers don't exist because the crisis doesn't exist. Because the policy isn't designed to solve a problem inside the NHS. It's designed to suppress a narrative the government cannot control. And the moment you bring Gaza into the frame, everything snaps into place. Because British health workers have been going to Gaza, haven't they? They've been working in those hospitals. They've been describing the injuries, the starvation, the amputations without anaesthetic, the systematic targeting of medical infrastructure. They've come home and told the truth on camera. And that truth makes the government's position untenable. It makes the government's arms sales indefensible. It makes the political alliance with Israel impossible to justify in public. And when Streeting orders NHS staff not to wear scrubs to protests, when pro-Israel groups dox doctors and nurses, when managers start suspending Palestinian nurses for wearing watermelon socks, you're not looking at coincidence here. You're looking at a coordinated incentive structure where the state and its ideological allies all want the same outcome: silence. All of these examples come directly from the public statement issued by Doctors Who Unite and the organisations endorsing it. So this isn't just censorship, it's a purge. And that word matters because it describes the scale of what's happening. Dozens, if not hundreds of staff already disciplined, suspended, interrogated, escorted off premises, told they are a threat to colleagues for mentioning a lunchtime protest. And not one of these cases involves concerns about patient care. Not one of them. Which tells you the purpose is political, not professional. They're removing people because of their identity or their solidarity with their own people, not because of their competence as medics. And you only need one eye open to see the racialised pattern in who's being targeted: Palestinian, Muslim, Arab, racialised staff. Exactly the groups erased from the government press release. And the cruelty is the point. You hear Palestinian clinicians describing losing family members, seeing their communities destroyed in real time, barely being able to sleep, and then going into work where they're told they can't wear a badge because it might offend someone. But somehow flying the Israeli flag from the DHSC is fine. Somehow the Ukrainian flag on hospital walls was fine. Somehow neutrality only kicks in when the solidarity flows towards Palestinians. When staff point out the double standard, the trust goes silent because there's no neutral explanation, is there? The policy only makes sense as discrimination. The legal side makes this even more absurd. The government hasn't consulted staff, they haven't consulted unions, they haven't done an equality impact assessment, they haven't followed health and safety consultation with employee regulations, so they're trying to force through a high-risk, high-impact cultural and legal transformation across 1.5 million workers, the NHS being the largest employer in this country, without meeting the most basic statutory requirements. And that's before you even reach the human rights angle. Article 10 still exists, freedom of expression still exists, and the High Court has already told the state in black and white that political criticism of Israel is a protected expression. So if they enforce this policy as written, surely they're going to eventually lose. It's not a question of if, it's when, and how much is that going to cost all of us from the public purse when they decide they try to fight it. But the government is counting on fear here. They're counting on the fact that an NHS worker can't wait 2 years for a tribunal. They know that being suspended destroys people financially. They know regulators move too slowly. They know trusts can get away with outrageous behaviour because most people don't have the time, the union backing, or the legal support to push back. And that's why Doctors in Unite stepping forward now matters so much, because they're calling the policy what it is: authoritarian, racist, discriminatory, and politically driven. And they're saying it plainly. This is an attack on workers, on rights, on the entire culture of the NHS, designed to force everyone into silence while the government backs a genocide. Once you step into the mechanics of this policy, you can see exactly how each component is designed to brace the others. You start with the IHRA definition. It looks harmless to someone who's never had to navigate the internal politics of a public institution because it's framed as a tool against racism, and nobody in the NHS is going to stand up and argue in favour of racism, are they? But the definition is written in such a way that its examples swallow its meaning. It doesn't define anti-Semitism, it defines disloyalty to Israel. And the High Court has already said as much by refusing to interpret its examples as presumptively anti-Semitic. So when the government insists this definition must now be inserted into every staff handbook, every HR policy, every disciplinary rubric, they're not fighting anti-Semitism. They're installing a political doctrine that ties your professionalism to your willingness to accept the ideology of a foreign state. Who's really running this country? And the reason this matters inside the NHS is because of how employment law works. It's one thing to say someone has breached a policy. It's another to embed that policy inside mandatory competencies. That's the master stroke here, if you want to call it that. Because once the DHSC says the new anti-Semitism training is aligned to statutory and mandatory competencies, the stakes change entirely. You're not just disagreeing with a policy, you're failing a required element of your job. Failing mandatory training has real consequences. Blocked pay progression, disciplinary action, dismissal, even deregistration. They're turning a political viewpoint into a professional obligation and calling it anti-racism. And you can see the contempt built into it as well, because they know exactly what they're doing. They know that the BMA voted overwhelmingly that criticism of Israel is not inherently anti-Semitic. They know the High Court has said political criticism of Israel is protected speech. They know Palestinian, Muslim and Arab workers are facing unprecedented levels of racism, including at work. They know none of this policy addresses any of that, and they know they haven't followed the legally required consultation procedures. They're not trying to fix racism in the NHS. They're trying to create a bureaucracy that punishes dissent. The uniform ban is the clearest example. When managers start telling staff that a watermelon on a screensaver is perceived as anti-Semitic, that wearing a lanyard in Palestinian colours is a disciplinary matter, that socks with a green stripe are a threat to safety, you've left the realm of policy and entered the realm of farce. And yet people are being suspended for these things, off the premises, escorted out, told they're a threat. None of that is about clinical conduct. If anything, the real clinical risk is created by removing staff from wards in the first place. You lose continuity of care, you increase pressure on colleagues, you destabilise teams, and you traumatise the person you've removed. And this is happening in a system that already can't fill rota gaps, can't retain staff, can't meet demand. They're harming patients here, all to silence staff. And when you follow the logic of the no political symbols line, you hit the absurdity straight away. Because if neutrality is the standard, then DHSC flying the Israeli flag breached that standard. The Ukrainian flags breached that standard. Donations of equipment to Ukraine breached that standard. Public statements of solidarity breached that standard. And yet none of those were treated as breaches, were they? So the rule is not about neutrality, it's about state alignment. You can show support for whoever the British government supports. You cannot show support for whoever the British government helps oppress. That's the rule. And they don't even pretend otherwise. And here's the part that hits the hardest. This isn't just about symbolism, it's about identity. When a Palestinian clinician can't wear their own cultural colours to work without fear, that's identity erasure. When a Muslim colleague is interrogated for expressing grief, that's cultural suppression. When solidarity with colleagues being killed in Gaza is labelled extremism, that's political silencing. And when all of this happens in the same breath that the government claims to be tackling racism, you realise the racism they're tackling is the racism that confronts their political priorities, not the racism that confronts actual people. Psychological harm is real too. You can hear it in the testimonies. Palestinian staff describe being interrogated after hearing their families bombed. Workers talking about being ambushed in corridors by managers demanding explanations. Nurses saying they're terrified to speak in case they're accused of misconduct. Staff taking months off sick because the stress is unbearable. Doctors leaving the NHS because they cannot live under constant suspicion. And none of this is an accident. Fear is a feature. It's built in. A workforce afraid to speak is a workforce that becomes easy to control. And the deeper context is the government's political collapse over Gaza. They're trapped between their public allegiance to Israel and the political cost of that allegiance. And the NHS is collateral. Because the one thing the government cannot have is a health workforce, trusted, respected, morally grounded, standing in front of the country saying they've seen genocide with their own eyes. They can deal with activists, they can deal with students, they can deal with judges, they can deal with journalists, but they cannot deal with nurses describing starving children. They cannot deal with surgeons describing amputations without anaesthetic. They cannot deal with paramedics describing whole families dug out from rubble. Health workers are the one group whose testimony cuts through all of the propaganda. And that's why they're being targeted now. Doctors in Unite are right to challenge this. They're right to call this a purge. It fits the word perfectly. You don't suspend people for wearing badges in a functioning democracy. You don't ban colours. You don't turn trading modules into ideological vetting. You don't silence grieving staff. You don't ignore your consultation duties. You don't weaponise HR to police political dissent. You certainly don't claim this is anti-racism while running out a form of racism the Forde Report already exposed inside your own political party that you still haven't acted upon. And the consequences are predictable. You create fear, you create resentment, you create inequality, you create a workplace where Palestinians are told their feelings don't matter, where Muslims are told their safety is secondary, where Jewish anti-Zionists are erased, where speech is policed based on political convenience. And the people who suffer are the same people already carrying the NHS on their backs. The government will push this as far as they think they can, but the legal ground beneath their feet is weak. They've sidestepped mandatory consultation. They've ignored equality law. They're breaching Article 10. They're imposing a definition already curtailed by the High Court. They're embedding a political doctrine into mandatory training, and they're discriminating based on identity and political belief. This is absolutely challengeable. It will be challenged, I'm sure, and the government will lose. Because the truth is very simple. The NHS is not anti-Semitic. The data shows no such crisis. The crisis is political. The crisis is the government's defence of a state committing atrocities, and the crackdown inside the NHS is not about protecting Jewish staff. It's about protecting the government's foreign policy from the moral authority of our health workers. And so you come to the unavoidable conclusion, the one doctors in Unite have spelled out very clearly. The government is driving a hierarchy of racism into the NHS to silence Palestine support, and they're willing to break the law, break trust, and break people to get there. Turning on workers is hardly new for this government, of course. They've done it again in this week's budget as well, hammering earners to excuse the rich as ever, but the scale of it might not have been immediately obvious. So get all the details of that story here. Please do also hit like, share, and subscribe if you haven't done so already, so as to ensure you don't miss out on all new daily content, as well as spreading the word and helping to support the channel at the same time, which is very much appreciated, holding power to account for ordinary working class people, and I'll hopefully catch you on the next one. Cheers, folks.